much. It's so great to be here. I'm Judy Baker. Practically everyone in the room knows me. You know how long and hard I have been fighting for health care. I'm the one with the health care background, 25 years delivering health care, expanding access to health care in rural areas, and so far I've dedicated my entire life to making sure everyone had a chance to see a doctor. I think it's a person's right to see a doctor. Simple as that. Why I got in this race? I got in this race, and I am the only candidate sitting at this table today that thought enough about your needs, about health care, to get up in December to challenge the incumbent, because the incumbent had voted against veterans' health care benefits and had voted against S-CHIP. And I thought that those were important enough issues that someone should get up and challenge him, and I was the only one with the courage and the passion to do so, because these are important issues. The thing is that you know that I've been fighting for the last 4 years for you down at the Capitol on health care cuts. It has been me. Many of you have seen me on the floor with a handful of others who have fought the Medicaid cuts of this governor. I've been the lead to do that and will continue to do that when I go to Washington. You know, I think the most important thing that we do is to restore, first thing, the health care cuts in this state. And I actually have a way to pay for it. I'd like you to ask my opponents if they have a way to pay for it. I have a way to pay for it. Do you remember a couple years ago when I was the only one that stood up for the clawback, against the clawback, remember? The clawback, the pharmacy were overpaying pharmaceuticals. Guess what it is now? It's $200 million a year. Do you know what $200 million a year does? It restores every single person back to health care. I have a plan when I go to Congress that we can actually pay for and restore these health care cuts. I want you to know that I will always fight for you. I have been there for you for the past 4 years. I will continue to be with you when I go to Washington. You know, I'm not going to go looking for a fight. I'm going to be ready for a fight if I need to, just like I did with the Medicaid cuts, but I am going looking for results. Thank you very much. I appreciate your help.
Hello, I'm Ken Jacob, and I also have a plan that would pay for health care, and it would do quite a bit more than $200 million. I would take the $35 million of profit away from the Medicare insurance companies that my opponent consults and helps them make money. I want to say that in 2004, when the Medicaid cuts were first brought to the legislature's attention, I began filibustering the very first day of the legislature to make sure that those cuts didn't come up for a vote. And on the very last minute of my time in the Senate, they were trying to bring those bills up. And they couldn't because of my filibuster. And I know Robin was there back then. And as soon as that session ended, my Republican friends cursed me. But I was very proud to have stopped the Medicaid cuts. Now, no sooner did I get termed out of the Senate and leave the legislature, then the very next year, as soon as I'm gone, when Judy comes in, then the Medicaid cuts, they pass. So I don't know what stand up and fight means, but I literally stood up and fought and stopped them. Now, I was offended that they didn't get stopped in 2005. It was a shame. Thank you. I'll be looking forward to answer your questions.
Good evening. Oh, come on. Good evening. I want to say to you all, first of all, I'm proud to be here tonight, and I'm proud of the work that you all do. I know what you are able to accomplish. I've watched you time and time again, and you all ought to be proud of how much of an impact you've had in this state. So give yourself. Now, I'm going to tell you something. I got a long list of things I could talk to you about, but we got a short period of time. I was Speaker of the House for 5 years in this state when Mel Carnahan was governor. In that time frame, we weren't talking about going backwards on health care. We were talking about insuring more people. And that's the kind of direction we need to return to. I was given the Leadership Award by the Missouri Hospital Association for passing the S-CHIP program in Missouri and getting thousands of Missouri's children insured. And then we worked on some other things like making something happen on access to health care. And I want to tell you, at a time when there were times over and over again when the health insurance industry, the special interests, tried to stop things we did in the House. One of the things that we worked on and we passed through the House was a provision that would have opened up the state and health insurance pool to individuals who wanted health care in this state. We passed that in the state. I was a co-sponsor of that bill. I'm going to tell you, health care is not new to me. I know what we need to do to get it done, and it's a pleasure to be talking about it tonight. Thank you.